It's warm.
See, I don't know where to place it to where it will see everybody. This is dumb.
I'm short.
What
About landscape.
do you mean?
Orange landscape.
Oh,
I know, right? I'll share it with you now.
it's so high up. He ain't gonna be able to hear me. I don't know. This hole is annoying. He's gonna get all this complaining too.
No, everybody's. Oh, you're recording already?
Yeah.
We'll restart it.
Well, I don't really care.
Oh.
I think that's good.
Yeah, you got Dad there.
You got this one? Yeah.
Bubba,
Wait, why am I raising
you're
my
gonna need
hand
to
for
sit over there and be quiet, okay?
Wait, what am I raising my hand for?
To prove you're not an AI.
Why are you recording on me?
I usually edit it out just so I don't forget to record.
Oh,
But he's gonna get all of it because he doesn't want me editing anything, so he can have all the chaos. Here's my note cards. Here's the back of the note cards. I don't have any more note cards, so you get pieces of paper. Here's all of them. Paper. Paper. In the little teeny tiny boxes. And then they're labeled. Number 1. I can't use AI. That's the whole point of this.
Nope.
All the way to number 5.
What do you say, Bubba?
All right, and then you want to see what's behind it? This is what's behind it. So you got it all.
You say thank you.
What's wrong?
You know, hey, I can't do hands very well, so I'll just put my hand up like this here.
Okay.
I don't know why AI struggles with hands. Get out of my chair, boy. You're supposed to be sitting over there.
what's wrong with that?
Well, does he want his own chair?
You want your own chair, Bubby?
He said.
Mommy?
She's finishing up a work call.
Just sit down and be quiet, okay?
We have another adult.
Okay. Grab a chair, Cheyenne.
No, we have another adult.
Aw, your little gecko.
He's an adult.
He's big.
Hey, Cheyenne, when Tuesday gets in here, will you shut the garage door for us?
I'll put your chair out. She's not in
Grandma,
here
that
yet.
part is broken.
My mom.
That's okay, Mama can
Mark.
sit her big butt in it. Stop playing with the balls.
Why? I like playing with balls.
I'm sorry.
And Susie does too.
Cheyenne, go shut the garage door.
Oh, sorry.
Scan us all. I'm gonna. It's okay. I'm gonna make sure it gets everybody. All right, everybody. All right, wave. Make sure you're not AI. Hi. It's the whole world. Okay. He's gonna be like, your camera's too far. But I can't see everybody. Okay. You can't see me at all. God, this is dumb. Let's see if it works right here. Okay. Hi, my name is Jessica Luebke. Dr. Mark Schoenfield with Yale Medicine 2024 wrote up to 3 million Americans live with pacemakers. 70% of them are 65 or older. So I am doing a speech on how something works, and we're talking about pacemakers. So I have worked in cardiology going on 4 years. I did electrophysiology, which is the electrical side of your heart, for 3 years. And then I'm going on a year with this hospital, Park West. Over the past few years, an increase in the number of people needing pacemakers has been on the rise. The 2 overall factors that would warrant someone needing a pacemaker would be arrhythmias in the heart and also heart failure. First, we will look into the aspects of the arrhythmias, and second, we'll discuss heart failure. Okay. Now that we've introduced the aspects, I'll be talking about, or regarding pacemakers, We'll first look at the types of arrhythmias. So pacemakers require many different types of arrhythmias in order to qualify for needing one. Most common reason for needing a pacemaker is bradycardia. So bradycardia is a slow heart rate, and also heart pauses, so when your heart just stops beating for a hot second. Bradycardia is when your heart beats too slow, causing a need for medical treatment such as a pacemaker. Hound MK with Mayo Clinic 2022 in May stated bradycardia treatment may include lifestyle changes, medications, management, or an implanted device called a pacemaker. Hound MK states that when the other treatment options have failed or symptoms are severe enough, a pacemaker device is necessary to control your heart rhythm. Bradycardia is when resting adult heart rate is lower than 60 beats per minute, which is below the normal adult heart rate, which is normally, when you're sitting down resting, is between 60 and 100 beats. Elderly are typically the ones that are prone to bradycardia. However, physical conditions plays a factor in a patient's bradycardia regardless of age. Keep moving and keep that heart pumping so we don't get issues. Not only is bradycardia an arrhythmia that causes the need for a pacemaker, having heart pauses is another diagnosis that will warrant a need for one. Daniel Miller with National Liberty of Medicine, June 2023, stated sinus pauses refer to a delay in generating or propagating the electrical current within a sinus node of the heart. Daniel states that these pauses can temporarily cease the heartbeat and are typically characterized by the absence of a P wave on an EKG. So frequent pauses that happen over a long period of time, a person may need a pacemaker. A heart pause that is greater than 3 seconds is when they think that you will need one, that you would actually qualify for one. In my cardiology office, it was 4 seconds, and my electrophysiologist, he really didn't even care until it was like 5 seconds, which is a lot. So now that we've discussed needing a pacemaker for certain arrhythmias, let's talk about needing a pacemaker for heart failure. Some patients suffering from heart failure may end up needing a pacemaker to help them need their heart to pump blood, and to slow the progression of heart failure. Heart failure is when the lower chamber of your heart, the ventricle, aren't able to pump as much blood to your body that it needs. HealthWise staff, June 2023, stated a pacemaker for heart failure can help a patient feel better so they can do their daily activities by slowing the progression of a patient's heart failure to help them live longer. A pacemaker sends electrical signals to the lower chambers of the heart in order to get it to flex, in order to pump that blood where it needs to go. Getting a pacemaker for heart failure providers look at patients' ejection fraction. The measures how much blood is pumped. I know what ejection fraction is, oh my gosh. So ejection fraction is when the blood that's coming, like pumping out of your heart, it measures how much blood is coming out of your heart. So the normal range is 55% or more. And so if you qualify for needing a pacemaker, it's going to be less than 55%. So a lot of my patients that need a pacemaker were like 45, and then it's really scary. In heart failure, the left ventricle often gets too big as it tries to make up for not pumping so well. A pacemaker can slow this change or help the ventricle to go back to a more normal heart size. Slowing the progression of heart failure is one of the reasons for a pacemaker. Heart Matters magazine states having a weekly pumping heart makes daily activities hard to keep up with. Life expectancy for heart failure continues to increase as the evolution of pacemakers tends to grow in technology. Heart failure symptoms are shortness of breath, fatigue, which is tiredness, frequent urination, sleep issues, edema, which is swelling, and then life becomes just really hard to manage. So the sooner that you get a pacemaker, the sooner that you can start going about your daily activities again. Heart failure affects more than 5 million Americans. Now that we've discussed the two aspects of needing a pacemaker, let's conclude. 2 vital overall factors that would warrant needing a pacemaker are arrhythmias and heart failure. Over the past few years, an increase in number of people needing pacemakers is on the rise. The 2 overall factors that would warrant someone needing a pacemaker are arrhythmias and heart failure. So Dr. Mark Schoenfeld with Yale Medicine 2024 wrote up to 3 million Americans live with pacemakers, 70% of them being 65 years of age. Thank you so much.
Is that 5 minutes? Did I dance?
Now you dance. No, you stood still pretty good.
And did I have a lot of ums?
I don't have one.
Yeah. Eat it.